If you're wondering why your team isn't consistent with making phone calls and you dread asking them if they've been calling patients to get them in, maybe because you feel like you're micromanaging them. Or if you're watching this and you happen to be one of the team members and you hate it when the office manager or the practice owner keeps asking you to call patients, maybe because you feel like you're annoying the patients by calling them. This video is for you. So here's what we're gonna get into. Number one, what your growing unscheduled treatment list of patients is costing you. Second, your team's attitude towards follow-ups and why they're not consistent. Third, changing their mindset. And last, the best practices for following up with patients, where reading a script is not the answer. Before I get into it, let me tell you why I made this video. Part of my job with Teamio is to train the team members in offices we work with on how to prevent patients from falling through cracks. And whenever I demo Teamio to offices that are interested in working with us, I always ask if they do any patient follow-ups currently at all. Majority of them will say that they don't really have any set protocols for following up with patients, and they simply just pull up their call list and call patients one at a time if they have openings in the schedule. And when I do train the team members on Teamio, I ask them how they're doing it now, and they literally say they just go down the call list and call one patient at a time. If the patient doesn't pick up the phone, which happens a lot of the times, they simply just go on to the next patient, and that same patient is never called more than once, which shocks me the most. And at that point, I take a step back, and instead of focusing on training them how to use Teamio and all the features, I'll actually focus on making sure the team understands the reasoning behind follow-ups. All right, let's get into it. Number one, the cost of the growing unscheduled list of patients. A lot of the doctors we speak with do some form of marketing, whether it's through direct mail, online ads, whether it's through Facebook or Instagram, or Google ads. And there are so many factors that determine how many patients actually walk through the door, right? You could have like the size of the practice, the number of providers or specialists in-house, which kind of increases the capacity that you have to see patients, the effectiveness of the marketing, and of course the marketing budget, etc. But to continue with the topic of this video, let's assume that a solo practitioner gets anywhere from 20 to 50 plus new patients a month. And group practices, for instance, that have multiple providers or specialists in-house, let's assume they're getting at least 40 to 100 plus new patients a month. If on average, you're spending 1 hour per patient, whether it's the solo practitioner or the group practice, that's a whole lot of patients keeping you busy with just comprehensive exams and treatment planning. And of course, getting new patients is the lifeline of any growing practice. From my personal experience though, during the growth phase of the early days of my startup practice, I was so focused on the marketing and getting new patients in that my schedule was just full of patients. And I wasn't complaining. I was either doing treatment plans from comprehensive examinations or providing treatment to the patients that were moving forward. I really wasn't tracking how much I was diagnosing or how much was actually getting scheduled. We barely looked at our unscheduled treatment report because, well, there was no room on the schedule. And at that point, I wasn't thinking about expansion because I could still accommodate the new patients. We got in such a rhythm of being busy that we lost focus from the new patients we saw 2 weeks ago who never really moved forward with any treatment, or the patients we saw last month who didn't move forward with treatment because they weren't sure of their schedule and who probably just needed a follow-up call to get them in. All right, moving on. Your team's attitude towards phone calls. Whenever I do training phone calls with our client offices and I speak with team members and office managers, I try to focus on understanding why they're hesitant to call patients in the first place. And usually the answers are all same throughout all team members across almost all the practices we work with. And here's the most common ones I hear. I don't want to annoy them. It always goes to voicemail and most don't pick up. I don't want them to think that we're desperate to get them in. And this last one is my favorite. I feel like I'm talking to a wall. Once I understand what's holding the team back from doing these calls consistently, I focus on shifting their mindset when it comes to phone calls. This is exactly what I've done in my practice. If I were to train my team on this, for instance, if I hired someone completely new, completely inexperienced with phone calls, how would I approach this? I always start by shifting their mindset. So instead of thinking, I may be annoying them, start thinking patients are busy with their schedule and their routine lives, and it's my job to make it easy for them to schedule their appointments and remind them. Instead of thinking, I don't want to sound like a salesman, start thinking patients forget and don't know their schedule, and it's my job to remind them to why they need to come in sooner than later for their fillings or crowns. What about this one? It always goes to voicemail. Put yourself in the patient's shoes for a second. When you get a phone call during the daytime from a number you don't recognize, well, most patients don't store their dentist phone number anyways, you're probably not gonna pick up and let it go to voicemail. and you may or may not listen to it. Another 2 to 3 weeks go by and you get another voicemail. You decide to not listen to that one either, but you know what it's about and it's on the back of your mind, but you decide to push it off further. Another 1 month goes by and you get another reminder. And now you know what it's about, you know you want to get it done, but you're so busy. But you put it on your to-do list finally, and maybe while you're driving, you're gonna call to schedule that appointment. But you see my point here? It happens to a lot of us. So what makes your patients any different? So the point is, for some patients, you're going to need to make more than 1, 2, 3, 4 phone calls. Now, you may not leave a voicemail each time. Maybe you're leaving a voicemail only alternate calls or alternate attempts. You have to just understand that percentage of these patients will call back to schedule. So it's a numbers game. More calls you make and stay consistent, more appointments you're gonna put back on the schedule. All right, let's move on to best practices for following up. The first one is you always wanna ask for permission before following up. Here's why. It removes surprises. Your patients know why you're calling them, which is complete opposite to what a lot of offices do when they reach out to the patient for the first time for a follow-up after like a whole year. And the team tells them that, hey, well, my doctor was reviewing your chart and they're concerned that the tooth is gonna fall apart and why you haven't come in for a crown. It just doesn't sit right. When you've asked for permission prior to following up, you establish trust and honesty with the patients. They're gonna feel like you're working with them instead of being sold to. And of course, you'll need to gauge and test their level of interest because some patients will outright tell you that they're not interested in moving forward and they don't wanna be followed up on, and that's completely fine. All right, let's move on to another one. Number 2, timing is super important. If you're following up with the patient from a pending treatment list, but you haven't followed up with this patient who needs a crown in more than a year, and in fact, you never followed up. How does it sound to the patient when you call and say, hey John, Dr. So-and-so is concerned about some pending treatment? What is going on in the patient's mind? Put yourself in the patient's shoes for a second and you'll start to understand why some of these patients never move forward with treatment. And again, it's discouraging when you're doing this for all the patients on the list. And it demotivates you when you've called 10 patients like this already and none of them pick up. And in fact, some you call back to follow up and no scheduled appointments on the list. The point is, set yourself up for success by following up in a timely manner after the treatment's been recommended by the doctor. Moving on to number 3, use multiple channels. Mix your patient phone calls with text messages and emails, depending on patient's preference. You're gonna find that some patients respond better to text messages than phone calls. However, if you're calling the patient or following up with the patient for the first time after they've seen you in the office, it's probably a good idea to do a phone call first. And if there's no response to that, then you can send a text message and an email, and then go back to a phone call and leave a voicemail. Number 4, avoid pressure. Never make the patient feel rushed or obligated. Instead, use language like, when you're ready, we can move forward at a time that works for both of us. You want to let them know that it's okay to take their time, but at the same time, you want to stress the importance of timely treatment. If the patient's recently completed a root canal on a tooth that didn't have much structure, it makes sense to stress the importance that they move forward with their crown as soon as possible. However, it doesn't make sense to tell a patient who's been missing their first molar for 15 years, for example, that they have to move forward with their treatment ASAP, otherwise their adjacent tooth is just gonna tape over, especially when the patient's aware that space has been maintained for so many years. Number 5, team training. Train your front desk and your treatment coordinators to be professional and empathetic. This is best done through role play scenarios. This is what I've done with my front desk, and actually it works every time, and it's so much easier to train them this way because you're doing it through examples and you just have them do it over and over again. But you need to set aside time to do this in the office. And in fact, this isn't just for follow-ups. It should be done for any sort of patient interaction, whether it's over the phone, through email, or in the office. Number 6, avoid scripted language. You want to encourage your team to sound conversational and natural instead of being robotic. And that's why training through roleplay makes so much more sense. You can go online and get these sales scripts for free or even ask ChatGPT. But if your team is literally just memorizing these words, it's just not going to sound natural. Number 7, what happens when a patient actually tells you not to follow up? There will be patients who tell you not to follow up with them. Just never take this personal. Never think, did I annoy them? Did I piss them off? That's the nature of any business. In fact, the whole team, the admin team, the providers, the hygienists, the assistants, the whole team can re-emphasize the treatments that was recommended at their next recall visit. Stay focused and stay on course with your mindset, and just focus on the next patient who's due to be followed up on. And finally, number 8, and most importantly, you want to track your follow-up processes and tweak and optimize it over time. Implement a proper system. Use a form of a CRM system to track patient interaction, their preferences, and a follow-up history. Our offices that we work with who use Open Dental, they use Teamio to make it super simple for their team to make patient follow-ups part of their daily routine. Unless you have a proper system in place that's easy for your team to use, follow-ups just aren't gonna happen. Or they'll do them for a little while, lose motivation, and become inconsistent. I've tried everything in my practice. I used to use Excel sheets to track follow-ups. I've even used the built-in Open Dental's patient notes on the schedule, where you set aside a separate column and create the follow-up reminders. But with everything that's going on at the front desk, the team just becomes overwhelmed when they have to create a follow-up reminder for all the patients. Even if they do create it, they forget to create the next one if they don't get through to the patient as a follow-up, another second attempt to follow reminder. And that's just for one patient, and they'd have to do this for all the patients they're supposed to follow up on. It just became unrealistic for me to expect the team to keep up with this whole process for follow-ups. Then finally, we created our own in-house solution that's completely integrated with Open Dental, and we made it available to other Open Dental users, and we have never looked back since. If you want more details and help on implementing this solution in your practice and you happen to use Open Dental in your practice, I've included a link in the description below this video to schedule a demo, or if you're not ready to schedule a demo yet, feel free to look around the website to see how the Teamio follow-up system integrates seamlessly with Open Dental. That's all I have for you guys today. I hope this was helpful and you go implement some of this in your practice, or if you happen to be the doctor or the manager, I hope you share this with your team, and I promise you it will help them make more phone calls. Until next time, take care.